Hi, everybody. My name is George Carrillo. I'm the CEO of Poder and here on Oregon Legacy. And today we have a special guest. We're going to be talking to former House Representative Teresa Leon. And we're going to be having a conversation regarding the HOP clawback money that is going to be coming back to the Oregon Health Authority from the community care organizations. And today we are going to have a better understanding of what is this money, what was it intended for, and what's the next steps? What are we trying to accomplish here as a community? So let me bring on Teresa here to have this engaging conversation with us here today. Teresa, hi, how are you?
Hi, George. Hope you're doing well. Thank you for having me.
Yeah, no, thanks. I was really appreciative of us having our conversation the other day, talking about our family, talking about how we were raised, and how the world has changed so much from then to now. And I don't believe we're that old, but I think our kids think of us that old.
Oh yeah. My little guy thinks that I'm older than dirt. He keeps saying back in the day. I'm like, not that long ago.
I know, I hear you on that. And I think, as we're having those conversations, I was really sort of thinking about how access to care, access to health insurance, how things have changed throughout the years and what that looks like today for Latinos. Like, things have changed dramatically. We have social media, we have iPhones, we have all these wonderful features, but it's not even accessible to many of our communities. I mean, even for me as a educated individual that has all these, that lives in the world of today, it's hard to even find a primary care provider. What are your thoughts on that?
Yeah, I mean, that's exactly right. We assume that because we live in this country, we live in Oregon, that we have access to the internet, that we can afford it. And actually, we do have internet deserts around Oregon. I think during COVID, we discovered that, especially in rural communities, not everybody has access to technology and the way that we think we do, because those of us who have it assume that everybody does too, which limits healthcare access as well. I mean, during COVID, you couldn't go to the hospitals just because you were sick and it wasn't severe. They were only accepting really severe people and asking people to stay home if you could to care for yourself. But we have a lot of comunidad in the rural communities that couldn't do that. And we also, in addition to technology challenges, we also have transportation challenges. A lot of our farm workers don't have their own cars and can't just get in a car and drive to the hospital or to a clinic. So this idea of having mobile healthcare, I think, was a great idea, and I know we passed a law on that, but it's not everywhere. It's limited to certain areas. So there's definitely a lot of work we need to do.
What we're here to talk about today is how the community care organizations have approximately about $100 million that, by contract, they're going to be giving back to the state of Oregon, back to the Oregon Health Authority. And so, what are your feelings on that? I mean, do you think that that's who do we blame? Is it acceptable? Is there anybody to blame? How do we sort of figure out this dilemma with why is $100 million going back to the Oregon Health Authority?
Yeah, George, that's a really good question. So back when I was a legislator, and I served on the healthcare committee throughout my entire tenure, 6 years of serving, I always brought up the concept of healthcare equity and how we're serving our most underrepresented communities in the state of Oregon. I always ask questions: are we communicating in the language that they need? Do we have bilingual, multilingual professionals who are treating our folks? Do we have enough interpreters? So all those services that our communities need. But we also know that even if our community has access to healthcare, our healthcare system is really complicated. I mean, even filling out the application when I was a legislator, I think we were able to push for the whole application to go from, I don't know, 100 pages or questions. I don't remember how many, but I just remember thinking, how are our folks supposed to fill this application out on their own? It's too much. Like I felt at the time we had too many barriers to access, and this situation with with knowing that CCOs are going to have to return $100 million back, just made me think about that there's still a lot of work to be done around cultural competency, around how CCOs work with community or don't work with community. I know we passed a law, one of my policies back in 20, I want to say 21, 20 or 21, with that included the regional equity coalitions to work with community, and of course include CCOs to think about how can we best serve the communities in our areas. And so there's still a lot of work to be done, obviously, because they're having to return money. But I think it's not the time to blame anybody, but it's a time to come together in community and partnership with CCOs to figure out, okay, we know that this money is going to go back to OHA, but let's work together to have a plan so it comes back out to the communities who know, or excuse me, the communities, but through the organizations that serve those communities. Let's create a plan on how to get that money back into community.
How do we find the root cause of the problem? And I think that the answer has always been that we need to rely on our community. Our community is not a problem that we need to solve. Our community has the answers. We just don't know how to use taxpayer dollars to be able to effectively engage our community.
That's such a great point, George. Yeah, that is such a great point. We know what we need, right? We know that if you're going to provide resources to an organization to provide services in partnership, state agency and an organization, you can't just say, okay, here's some money, but miss the mark around how that is going to be utilized. There's an assumption that I've worked for nonprofits before, and I know that a lot of organizations work their tushies off to help community. A lot of folks work so hard, and when we provide funding to them to continue to work with community, we forget some very important factors. One, that to better support community, we need to increase capacity, and we need that time so that they can hire and then train folks and then provide those services. That you can't just drop money and all of a sudden expect things to work so in some magical way, right? There has to be a process. And at the same time, there has to be a whole education program that helps community understand the services and help them navigate the services that they need. Because again, we can't assume that everybody knows how to navigate systems that have been complicated their entire life, but they never had access to it. So there's a lot of work that we need to do to make sure that the implementation happens in a coordinated, structured way. And organizations know how to do that, but we need to make sure that when we fund them, that we give them that grace and that opportunity to create a very structured system that does take time, because not all organizations have the capacity to start running the moment they get the money. It really is a process.
For some people that may not know, I used to work at the Oregon Health Authority, and being at the level that I was, working for that agency, you can see that they still struggle with sort of institutional norms that translates into institutional racism. And it's a ever evolving problem that they're, actively trying to resolve. But when I look at how government and other organizations try to work together, but when it's not being inclusive of our community, these are sort of the results that happen. And so, the community care organizations didn't meet the need. And so by contract, they have to give the money back. And they understand that. And so the money's going to go back to the Oregon Health Authority. But what we know from the Oregon Health Authority is that they can't get the money out to the community quick enough. There's always constantly delays, which only delay us. And so in these two sides, it's, business as normal. But for communities of color, we're always vying for a small piece of that, that equity pie that's always in front of us. What would $100 million do for us if the government actually put that to work directly with community-based organizations? No more of these small grants, but actually invest $100 million into community-based organizations. What do you think the result would be?
Yeah, that's a really great question, George. That would mean, again, increasing capacity. So giving people jobs to help other people. Ensuring that we have bilingual and culturally competent folks help our community access the healthcare system and walk them through the process, because it is a complicated system, which means then that we would have a healthier community because they would have somebody who could provide that guidance. Right now, I think there's some organizations that are doing this work, and they are overloaded, and it's frankly not fair, because they need to increase capacity, they need to increase training, but it costs money, and so $100 million going back to the organizations who know how to serve our community would be a game changer for Oregon and respect to healthcare.
I agree with you. I think $100 million, it just doesn't support the community-based organizations. It supports the community that they're serving. And I think across all, industries, because just like everybody else, we're trying to work, we're trying to manage a family. We are all trying to understand, what does access really mean? And sometimes access comes down to, it's like, hey, I've got healthcare coverage, but my deductibles are too high, or I don't have childcare, or I don't have the ability to leave work to even just go for myself to go get a checkup. If we were just to be able to take some preventative measures, it would make our community healthier. It would keep insurance costs lower. And so I think that this $100 million is more than not just meeting a contract obligation. It's not meeting the health needs of our Latino community, which I want to remind everybody, we are the largest minority group here in Oregon. And then on top of that too, I want to dive into a little bit of, I guess, some taboo when it comes to the Latino community. I feel that across the nation, as I've worked all over the United States in my last position, we're pretty fragmented as a community. I think that we are all trying to vie for that piece of the pie, whether it's recognition or it's funding. And I really do feel that we need unity. And I think that this right here, this project that we're talking about here today, this is the opportunity for us to be able to come together and to do what's in the best interest of our community. Can you talk to me a little bit about, the opportunity that we have here today to come together as a community to have one single voice?
Yeah, thanks, George. So I want to recognize that, we're not the first group that's bringing community together to have this discussion. Obviously, OHA had a group that came together to figure out Senate Bill 558 and the implementation. There was a group, a committee that came together for that. I also want to recognize Olivia Quiroz from the Oregon Latino Health Coalition. She's been doing a lot of amazing work also to bring community partners together to figure out how can we get this funding back into community. So these efforts, I'm really excited, are adding to this intentional work that is so very important. And your question around, what can be done when we all unify? Well, I think the important aspect of that question is when communities come together, that equates to a level of voice that that is stronger. And when we are saying the same thing at the Capitol, then legislators have no choice but to listen. And certainly, we need everybody, all organizations who believe that this funding needs to go back to community partners and to help community. And this is one gathering where I think that we can unify and become one voice and support the work that's been happening and continue the work in unison. And I'm excited. I'm excited to hear what others have to say. I'm excited about ideas. I'm excited to potentially bring a policy together that we can present at the legislative level in 2025 and ensure that this funding does go back to community who know community, or I should say community partners who know how to serve community, because it's what they've been doing.
Well, thank you, Teresa. This has been a really fun, engaging conversation. This is, I think, a very exciting time for all of us to be able to come together, not just as community-based organizations, but being able to work with community care organizations, be able to work with legislature, the Oregon Health Authority, because it is a very important topic, and we do really need to be able to understand, how do we come together, how do we resolve this together, and that no one single body is making a decision for an entire community. So thank you again, and until next time, everybody, we'll see you again. Bye-bye.